The Workforce application is a digital health solution to improve healthcare worker efficiency, enhance consumer engagement throughout their care journey, and expand consumer choice with options for provider-monitored post-surgical self-care. The Workforce app is versatile. It can be used by any level of healthcare worker for any health service delivery area along any continuum of care. We will use the Zimbabwe VMMC experience in men's health to demonstrate one application of the system. Workforce app supports offline functionality. Healthcare workers can use any phone with a browser. Clients can use any phone, including a basic one. The Zimbabwe Workforce app operates along a VMMC continuum of care from demand creation and e-referrals from communities to clinics. It then expands choice for clients to self-care during the 42-day post-surgical recovery period through monitored two-way communications with the system. In communities, Workforce app supports messages delivered to potential clients at each IPC touchpoint. Community health workers register interested clients into the Workforce app, which issues a unique e-referral code to the client at the end of an IPC session, either electronically to the client's phone or by paper. Workforce app sends automatic reminders to clients who have an unredeemed referral code to encourage them to go to their closest clinic for more information or for services, reducing the likelihood of losing the client. When the client arrives at the clinic, a provider enters the referral code into the Workforce app to pull the client's information, crediting the linkage to the mobilizer. On the service side, providers counsel clients before and after services about the importance of proper wound care, bandage removal, and post-surgical reviews in the 42 days after receiving the service. Providers give clients options for post-surgical follow-ups, either physically with providers or virtually through monitored self-care with the Workforce app. The advantages of provider-monitored self-care are explained, including convenience and time and transport saved for both the client and the provider. Those clients choosing self-care through the Workforce app learn how the system will work, the type and frequency of messaging, and how and when to respond. Virtual client follow-ups are activated for clients who choose to self-care through their preferred channel, either zero-rated two-way SMS with one of Zimbabwe's 2 telecommunications platforms, or WhatsApp. Providers test the phone contact to check that automated messages reach the client. Workforce app's standard messaging algorithm engages daily with the client for 12 days after service delivery, and then weekly through the end of the recovery period on day 42. Messages prompt the client to exercise proper wound care and bandage removal and to report back on days 2 and 7 for an update on their healing journey after asking about post-surgical symptoms like bleeding, pus, or pain. If a client misses a response, responds yes to these symptoms, or reports concerns, Workforce app automatically notifies their provider by SMS and provides the client's phone number for immediate provider follow-up. Workforce app offers options for the client to request repeat wound care or bandage removal instructions, to opt out of messaging, or to request their service provider to contact them anytime. It also gives the client the opportunity to refer a friend through the app if they were pleased with the service. The system is decentralized. Providers monitor in-person and self-care follow-ups with their own cohort of clients on their own device with real-time visibility into each client's history self-caring with Workforce app. Providers follow up clients who do not report in on day 2 and day 7 by filtering their client list for non-responders, and receive SMS prompts when clients don't report back or report signs of complications or concerns. A central digital nurse monitors provider use of the system, tracking outcomes for each client to verify that all clients receive follow-ups, whether in person or through self-care, and to verify IMOK outcomes. To date, community health workers issued over 32,000 unique e-referral codes. Over 15,000 of those unique codes were redeemed by clients for services. 62% of all clients choose provider-monitored self-care through Workforce app as their preferred follow-up method. 55% of those choosing virtual follow-ups actually self-cared through the system, and the remainder were followed up by their provider. 83% of the over 8,000 provider-monitored self-caring clients reported being okay after the system prompted them, with possible signs of complications. 4% reported signs of complications and 10% reported concerns for provider follow-up. 2% requested repeat instructions from the app. Workforce App saves provider and client time, travel and transport costs for providers and clients versus expensive in-person follow-ups, and expands choice for clients to self-care in a post-service recovery period, while being monitored virtually by their own service provider. Workforce App offer convenience and efficiency for clients and providers by focusing healthcare workers on improving quality of care for new clients and for the clients who need them most. While we've demonstrated the Zimbabwe Workforce App for VMNC, the system is scalable, decentralized, and adaptable for any healthcare worker at any level of the system along any continuum of care. PSI seeks to scale consumer-powered healthcare. One core pillar of this strategy is to shape mixed health systems. The Workforce App is one powerful example of digitizing consumer-provider engagement and health system coordination in an effort to shape mixed health systems in Zimbabwe and beyond. Workforce App provides a platform for seamless longitudinal engagement with clients right from demand creation and linkage to care through to service uptake and post-service care. The application's 360-degree view of the client enables personalized healthcare, which can improve health outcomes. Workforce App differentiates itself by making use of a device-agnostic technology which responds to the ever-shifting needs of the end user and connecting to a variety of back-end technologies and data standards, including the Health Industry Standard, FHIR, and DHIS2. This enables full interoperability with other partner organizations and ministries of health, allowing health systems interconnectedness to support health systems strengthening and drive the universal health coverage agenda. Unique features such as secure data access and storage, digitized job aids, and two-way communications with clients improve the quality and efficiency of healthcare delivery. Workforce App is scalable, and the agile implementation framework makes it adaptive and responsive to user needs. Workforce App is currently implemented in 11 countries along HIV and sexual and reproductive health continuum of care. The roadmap remains to expand use of the system more broadly in support of universal health coverage, and to make the platform open source and positioned as a global good.